So for the follow-up of patients who are premature birth asphyxiated, for birth asphyxia, generally follow-up is going to be based on the saturation, the sebum and Anderson score daily. That is as easy as that. And that's what you have to evaluate for birth asphyxia. For prematurity and low birth weight, you have to, for prematurity, you follow up the corrected gestational age. You have to speak about the corrected gestational age daily. Basically, you have to speak about if there is any abnormality of the vital sign, a vital instability. Basically, instability. Basically, if there's a vital sign instability, it's also going to be problematic in cases of premature and low birth weight, because generally you need to know that premature and low birth weight, for you to shift from the incubator into the KMC, they must have vital signs stable. Basically, for them to start the kangaroo mother care, their vital sign must be stable in order for you to shift from the incubator into the KMC. The third element after the vital signs that you have to follow up every day, you have to follow up the weight every day, and the weight gain must be 20 to 30 grams per kilogram per day for a premature, and should be 15 to 20 grams per kilogram per day for a term baby. Basically, that is the weight follow up of the child. Basically, so those are the different elements that you have to follow up. You have to also follow up with the Fenton score. Basically, and the Fenton score follow up is weekly. Basically, where weekly you have to evaluate for the length, the head circumference of the child. Basically, the next element that you have to follow up, you have to follow up for the residue. Basically, the number of fees that is given at different time and the residue that is given. Those are the elements that you have to follow up again. Basically. So you have to also follow up if the child is defecating and if the child is urinating. Basically, so those are the different elements of the follow-up, basically, which can help you to know. So from here, you have visualized all the tutorial on birth asphyxia and that. So say thanks for your kind attention.